Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. How are you all? Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topic, previous year question paper in detail, rationals of each and every options, additional golden points. So watch the video till the end. Only 2 months is there for your upcoming NORCET examination. So prepare yourself properly. Already so many Magic Pill videos are streaming in YouTube channel, that is E-Nursing Metier YouTube channel. Watch those videos for getting better understanding about the questions, how to solve the questions, what are the strategy to follow to solve the questions. Okay. So with your thought, we can start the questions discussion. The mind is like a muscle. The more you use it, the stronger it becomes. So you have to train your brain again and again. How much you are training your brain, that much you are getting stronger to solve the questions in the examination. With this thought, let's start the session. The first question is a 54-year-old woman present with abdominal mass and ascites. Her serum CA 125 and CA 72.4 are markedly elevated. This is the first key point. Always I used to say to you guys, you have to identify the key point, and second one, the last line is very important. So the first key point in this question is CA 125 and CA 72.4 is elevated. In which carcinoma it will be elevated? This is the first question you're supposed to ask. The second one is CEA, CA19-9 and SCC, that is squamous cell carcinoma. CEA means chorionic embryonic antigen. Okay, so these things are normal. These three things are normal. So two things are elevated, that is CA 125, CA 72.4 is elevated, and CEA 19.9 SCC is normal. So in which condition CA 125, CA 72.4 is elevated? This is the question. If you know about these two carcinogen agent or carcinogen antigen or tumor marker, easily you can solve the question, because this is the memory based question. So for this question, the right answer is going to be option B, that is ovaries. Here the patient is having elevated CA 125, CA 72.4. This elevation you can see in ovarian cancer. So here the right answer is going to be option B, that is ovarian cancer. Why not other options? See, they have mentioned CA, CA19-9, SCC is normal. In uterine cancer, CA will be elevated, CA 125 will be elevated, SCC will be elevated, right? But here CA, CA19-9, SCC is normal, so you can eliminate option A, that is uterine cancer, okay, because CA is normal. But here the CA is elevated in the uterine cancer. See, usually CA will be elevated in the uterine cancer, but in this question they mentioned that CA is normal. That's all. Just eliminate uterine cancer. The next one is stomach and pancreatic cancer. In stomach pancreatic cancer also CA will be elevated. You can see here CA, CA19-9, CA 72.4. But first we can take CA, right? CA is elevated in the stomach and pancreatic cancer. But in the question they mentioned that CA is normal. So you can remove this option also. The last one, colorectal cancer. Here also CA is present. Chorioembryonic antigen, CA19-9 is present, M2PK is present. These things will be elevated in the colorectal cancer, right? But in this question they mentioned CA is normal. Okay, but in colorectal cancer the CA will be elevated. So you can eliminate colorectal cancer also, right? So at last, which is going to be the right answer? If there is elevated CA 125, elevated CA 72.4, the right answer is going to be ovarian cancer. In ovarian cancer, these two things is going to be elevated. Understand, right? In rest of the things, the CEA should be elevated, but in the question they mentioned that CA is normal, so we can remove all these options. At last, the right answer is going to be option B, that is ovarian cancer. And for your better understanding, here I have added all the tumor markers and the abbreviation of all tumor markers. Just pause the video and look into it, take your notes. This is the memory based question. Definitely from the tumor marker, you can expect a question. So you can see, I will give you two examples. For thyroid cancer, thyroglobulin and CEA will be elevated. And for prostate cancer, free prostate specific antigen, prostate specific antigen will be elevated. Like that, for each and every cancer, I have given the tumor markers here. And the abbreviation of tumor markers you can see here. Okay, so whenever you are studying, you have to study with total dedication, with full 100% confidence. Okay, so how your confidence will develop? You should know the rationale of each and everything. You should know the concept behind each and everything. Okay, that's why we are struggling to give the important additional golden points to you guys. Okay, right? So these are all the tumor markers. Please make a note of it. Definitely one question from the tumor marker you can expect from the examination. The next question what we are going to discuss is related to Duke's criteria. Again, very important, repeatedly asked question. Always remember, first before discussing about the Duke's criteria, let me explain about the Duke's criteria in detail. Okay, so what is Duke's criteria? You can see here, see Duke's criteria, usually we are using it to identify the infective endocarditis. Duke's criteria for infective endocarditis. So in this Duke's criteria, two major criteria are present. You can see here the major criteria and minor criteria. These two criteria are present in the Duke's criteria. Why? What is the use of these two criteria? To confirm whether the person is suffering from the endocarditis or not. Okay, to confirm whether the person is suffering from infective endocarditis, we are using major criteria and minor criteria. In major criteria, two things are there. In minor criteria, four things are there. Listen. What are all the things present in the major criteria? See, two things are present in the major criteria. The first one is, please remember this, very important, positive blood culture. And second one is endocardial involvement of the microorganism. See what is happening. See, it is an infective endocarditis. Infection is present within the endocardium. Bacterial infection is present within the endocardium, and here the organism is multiplying excessively and damaging the endocardium of the heart. Even it is damaging the tricuspid and bicuspid wall. At one particular point, what is happening? The organisms and the cells of the endocardium mixing together, and it becomes like a clot, and that clot is traveling in the blood and it is affecting many organs like kidney. Understand? So this is the pathology behind the infective endocarditis. So here to diagnose really the patient is suffering from endocarditis or not, we are using the Duke's criteria, major and minor criteria. Okay. So in major criteria, as I mentioned already, two things are there. The first one is endocardial involvement is present or not. Bacterial endocardial involvement is present or not. We have to confirm that. How we can confirm that? We can use the echocardiography. By means of using the echocardiography, we can confirm bacteria is present within the within the endocardium, and it is causing the damage to the tricuspid, bicuspid wall, and causing the damage to the endocardial tissues. All these things, cardiac abnormalities, endocardial abnormalities, we can confirm with the echocardiogram. So this is the first one which is present in the major criteria. And second one, see, it is an infective endocarditis. So definitely bacteria, that is a microorganism, it will travel in the blood. So if you are taking the blood sample for sending for the culture, definitely positive culture report will be coming, right? So this positive culture report is also coming under what major criteria? So two things are there in the major criteria. That is, the first one is positive blood culture and second one is endocardial involvement, heart damage. Apart from that, minor criteria. In minor criteria, four things are there. The first one is history. See, if the patient is continuously having the drug history, IV drug history. See, whenever there is injecting the drug with the contaminated needle, the bacteria is entering inside the body, and it is a risk factor for the body, especially to the heart, because the bacteria which is injected through the needle, it will travel in the blood and it will go near to the heart, or it will go inside the heart and it will cause infective endocarditis. So this risk factor, that is IV drug use, is one of the risk factor, and it is coming in minor criteria. And second one is rot spot, ROTH, rot spot. See, two things are coming under rot spot. The first one is Janus lesion, very important, repeatedly asked question, guys. Janus lesion and Osler's nodes. See, please remember this, very important. Janus lesion is a painless lesion. What lesion? Painless lesion. Okay, I will show the image also. And Osler's node, it is a painful lesion. See, Osler's nodes, it is a painful lesion along with the nodules. You can see here, this is the Janus lesion, it is a painless lesion, and this is the Osler's node. Here you can see the nodes, there is swelling. Okay, along with the nodes, pain will be present. Along with the pain, lesions will be present. You can see the lesions here, right? So pain, lesions, nodules are present, means that is called as Osler's node. Without any pain, only erythema is present, means that is called as what? Janway lesion, both are coming in rot spot, ROTH, rot spots. Okay, so these things are also coming under what? Minor criteria. And the last one is fever. Definitely infection is there, means fever will be there, right? So fever is also coming under what? Minor criteria. Okay, so major criteria, minor criteria. Based upon these things, we are concluding whether the patient is suffering from infective carditis and which type of infective carditis. See, three types are there in the infective carditis. I will tell that also. Definitive, possible, rejected. Definitive positive is very important. And definitive is more important. See, definitive means what is that? See, the patient is suffering from two major criteria, means it shows the patient is having definitive infective endocarditis. The first point. Otherwise, one major criteria is present and three minor criteria is present. One major criteria, three minor criteria. That time also positive definitive infective endocarditis. Definitive means definitely the infective endocarditis is present. Okay, and the last one is five minor criteria. Five minor criteria. Okay, there is no major criteria. Five minor criteria is present, means that time also definitive in the infective endocarditis. So three things they have mentioned here very clearly. Either two major criteria is present, or one major criteria, three minor criteria is present, or five minor criteria is present. Okay, so in that condition, we can go with definitive infective endocarditis. What about possible infective endocarditis? Means 50-50. We are not definitely surely saying. Here 50-50 chances are there. So that is called as what? Possible infective endocarditis. Here two criteria are there. The first one major, one minor symptom is present. We can think about positive infective endocarditis. Otherwise, three minor criteria are present. We can think about positive or possible infective endocarditis. Okay, and rejected infective endocarditis means here the patient has some symptoms, but the symptoms are resolving within 4 weeks. Sorry, not 4 weeks, within 4 days. Symptoms are present. Whatever the minor criteria symptoms we have seen here, these symptoms are present for the patient, but it is resolving. Recovery is there within 4 days. So usually in infective endocarditis, this much fast recovery you cannot expect. But here the fast recovery is present, means it is not an infective endocarditis. So in that condition, we can call it as rejected infective endocarditis. So now you understand what is Duke's criteria, minor category, major criteria, right? Infective endocarditis and its types, like definitive infective endocarditis, positive infective endocarditis, and rejected infective endocarditis, right? So now we can solve the question. Okay. The patient is suspected with infective endocarditis, have the following symptoms. That is, fever is present. That is minor criteria. One minor criteria is present. IV drug user, second minor criteria is present. Positive blood culture, there is one major criteria. Positive blood culture is coming under major criteria. Okay, and rot spot are present. That is Janus rot spots and Janus lesions, and one more Osler's nodules lesions. Right? Fine. So four minor criteria: one fever, one IV drug user, two, and rot spot, three. In rot spot, two things are there: Janus and Osler. So totally four. So four minor criteria and one major criteria is present, means it shows what? It shows what? Just now we have discussed. Okay. So one minor criteria, three major criteria. Sorry, one major, three minor criteria is present, means see here. One major, three minor criteria is present, means what it is? It is definitive infective endocarditis. Understand, guys? So this is how you have to solve the question. So here the right answer is going to be what? Option C. Why we selected option C? Because it is a definitive infective endocarditis with one major and three minor criteria. Understand, right? Fine. So let's move on to the next question, that is related to John's criteria. So far we discussed about Duke's criteria, that is related to infective endocarditis. Now we are going to discuss about what? John's criteria. This is not that much difficult when compared to Duke's criteria. Duke's criteria is also okay, simple only, but you have to understand about the concept. Okay, fine. So now we are going to discuss question number 3, that is related to John's criteria. Let's discuss in detail. So 11-year-old child is brought to the outpatient department with a complaint of fever, pain that shift from one large joint to another joint. This is called as migratory pain. Okay, from one joint, the pain is shifting to another joint. Okay, so this is called as what? Migratory pain. Okay, so migratory pain is present, fever is present, and also the patient has the history of sore throat 3 weeks ago. So third point is sore throat, that is not treated. On examination, the child has heart murmur. Fourth important point, fourth key point. Elevated ESR, erythrocyte sedimentation rate. It shows the patient is having infection. Usually ESR, when it will elevate? During the infection. So these are all the key points, guys. And based upon the Jones criteria, what diagnosis we can confirm. So 4 options they have given here. Child has only minor criteria and diagnosis cannot be made. Child has 2 major criteria, 1 minor criteria, suggestive of rheumatic fever. Usually Jones criteria, it is used to assess the rheumatic fever. Duke's criteria, infective endocarditis. Jones criteria for the rheumatic fever. Okay, right? Fine. So the third point, child has infective endocarditis and child has osteoarthritis. This is the fourth point. Okay. So here the right answer is going to be what? Option 2. That is 2 major criteria, 1 minor criteria is present in this question. So the patient is suffering from rheumatic fever. What is that 2 major criteria and what is that 1 minor criteria? You can see here the major criteria, you can see here, that is the first one is migratory polyarthritis, shifting of pain from one joint to another joint. So migratory polyarthritis pain is present for the patient. This is coming under what? Major criteria. And also the patient is suffering from heart murmur. Usually heart murmur, in which condition it will be present? It is present in the carditis. It is present in the carditis. Okay, so these 2 criteria is present in the major one. And here the patient is having fever and elevated ESR. These 2 things are coming under what? Minor criteria. Okay, so 2 major criteria and 2 minor criteria is present. So it shows what? More than 1 minor criteria is there and 2 major criteria is there, means definitely we can confirm the patient is suffering from rheumatic fever. So on the whole, the Jones criteria, it is used to confirm the patient is suffering from rheumatic fever or not based upon the symptoms. You can see here, for your better understanding, I have added the simplified form of the modified Jones criteria. Okay, you can see I have added the mnemonic also. Major criteria, just remember Jones. And for minor criteria, remember Frapp's. In Jones, in major criteria, you can see the joints are involved, that is migratory polyarthritis is present. O stands for art, that is carditis is present. Whenever there is a carditis, new murmur, inflammation of the heart, these 2 things will be present. Okay, so joint involvement is there, carditis is there, nodules are present, especially over the joints. You can see there. Nodules, that is subcutaneous nodules over the joints. Okay, and the fourth one is erythema, lesions. Okay, that is called as erythema marginatum. Okay, and Sinenhans chorea, involuntary muscle movement. So joint involvement, that is migratory arthritis, carditis, nodule involvement, erythema, Sinenhans chorea, all these points are present or coming under what? Major criteria. Coming under major criteria. And in minor criteria, fever, rheumatic history, arthralgia, previous streptococcal infection, and elevated ESR and elevated CRP, these things are coming under minor criteria. So you have to memorize these things. What are all the things coming in major, what are all the things coming in minor, these things you have to memorize. Okay, and how to confirm rheumatic fever? 2 major criteria and 2 major criteria is totally present, means you can confirm the patient is suffering from rheumatic fever. You can see here, I have mentioned here also, 2 major criteria is present means rheumatic fever. Otherwise 1 major criteria, 2 minor criteria is present means that time also rheumatic fever. Okay, right? So 2 major criteria present, rheumatic fever, 1 major, 2 minor criteria present, that time also rheumatic fever. And in this question, 2 major criteria and 1 minor criteria is present. So definitely 100% we can say the patient is suffering from what? Rheumatic fever. Understand, right? So this is all about the Jones criteria. What is that? Jones criteria. Duke's criteria for infective endocarditis, Jones criteria for rheumatic fever. Okay. The next one, a nurse is assessing the patient airway before endotracheal intubation. During examination, only the soft palate, first key point, soft palate and the base of the uvula is visible. This finding corresponds to which Mallampati classification? So here in this question, they are clearly asking about the Mallampati classification. So what is Mallampati classification? See, Mallampati classification is the one used to assess for the airway patency before endotracheal intubation. Okay, so here they mentioned that soft palate is visible. They are trying for endotracheal intubation. Before endotracheal intubation, they are checking the airway. In that airway, the doctor can see only the soft palate, okay, and the base of the uvula. I will show the image. If these two things are visible, other things are hidden, in that case, which classification is this? This is the question. Okay, right? So 4 classification they have mentioned here: class 1, class 2, class 3, class 4. Here the right answer is going to be option C, that is class 3. Why class 3? See, in Mallampati classification, class 3, I'm talking about class 3, only the soft palate and base of the uvula is visible. I will show the image. See, these are all the different classes of Mallampati classification, and they are using the Mallampati classification to assess or to check the airway before endotracheal intubation. Underline the key point. So 4 classifications are there: class 1, class 2, class 3, class 4. So the normal one is class 1. Class 1 is the normal one. In normal class 1, what you can see everything. Means soft palate, hard palate. Fauces means this opening. This opening visibility will be very, very clear. That is called as what? Fauces. Even you can see the uvula. This is the base of the uvula. Okay, so from the base, from the first part till the base, everything is visible. And pillars, that is tonsil pillars, are clearly visible. Right? So soft palate, hard palate, total uvula, and fauces. This full opening is called as fauces. Tonsils, pillars, everything is clearly visible, means the airway is patent. Easily you can insert the endotracheal tube. This is coming under class 1 Mallampati classification. Suppose if the tonsil pillars are slightly hidden, it shows partial closure of the airway. Partial closure of the airway. Rest everything is normal. See, soft palate is normal. Fauces, this opening little bit present. Okay, not like this. Here the fauces is bigger. Here the fauces is little bit shorter, narrower. Okay, so uvula is visible. Uvula is also visible. But the pillars, no, these pillars, tonsil pillars, are little hidden. So tonsil pillars are little hidden. This is the key point of class 2 Mallampati classification. Tonsillar pillars are slightly hidden in the class 2 Mallampati classification. That time also little difficult will be there in the endotracheal intubation. And in class 3, you can see only the soft palate. This is the soft palate. Okay, and base of the uvula. This is the total uvula, but here you can see only the base of the uvula. Understand? So if these kind of characteristics are present, okay, so that time you can consider it as a class 3 Mallampati classification. You cannot see the uvula, you cannot see the soft palate, only hard palate is visible. Only hard palate is visible. That time it is called as what? Class 4 Mallampati classification. Okay, right? So with that understanding, we can conclude that here only soft palate is visible and base of the uvula is visible. Only soft palate is visible, base of the uvula is visible. So this one is coming under what? Classification 3. Mallampati classification 3. Clear, right? So the next question is, a 62-year-old man is brought to the emergency department with a sudden loss of consciousness. First key point, on examination he has a pinpoint but reactive pupils. Pinpoint but reactive pupils. Irregular respiration. Respiration is present but irregular. Okay. And quadriparesis, weakness of the limbs and facial muscles, and severe hypertension is present. So these are all the key points they have given. Which of the following is most likely diagnosis? And they are asking the diagnosis. They have given some key points and they are asking the diagnosis. 4 options: opioid poisoning, Horner syndrome, Pontine hemorrhage, and third, cranial nerve palsy. See, opioid poisoning. In opioid poisoning, pinpoint pupil will be present. Okay. And Pontine hemorrhage, option C, Pontine hemorrhage, pinpoint pupil will be present. So opioid poisoning and Pontine hemorrhage, in these two conditions, what will be present? Pinpoint pupil will be present. But one important key point is there in the question. Irregular respiration. See, in Pontine hemorrhage, irregular respiration will be present. But in opioid poisoning, respiratory depression will be present. This one make you to think. Opioid poisoning, pinpoint pupil present. Pontine hemorrhage, pinpoint pupil present. In Pontine hemorrhage, irregular respiration will be there. But in opioid poisoning, respiratory depression will be there. Understand? So this is the difference. What about Horner syndrome? In Horner syndrome, sympathetic nervous system is affected. Meiosis will be there, ptosis will be there, loss of ciliary muscles will be there, right? Anhidrosis will be there, right? But these things are not present here. And third cranial nerve. What is the third cranial nerve? Olfactory, optic, oculomotor. Oculomotor nerve is affected. Okay, that time pupillary dilatation will be there. Okay, right? So, but here pinpoint pupil is there. What is that? Pinpoint pupil. So we can easily eliminate option B, option D, and option A. So which is the leftover one? Pontine hemorrhage. For this question, the right answer is going to be option C, that is Pontine hemorrhage. Based upon the key findings, that is pinpoint pupil, irregular respiration, quadriparesis, severe hypertension, all these things shows there is a hemorrhage within the pons, that is Pontine hemorrhage. Understand, guys, right? And whatever the information I have given, there is in opioid poisoning, pinpoint pupil present, and Pontine hemorrhage also pinpoint pupil present. You can see here. Okay, two areas pinpoint pupil will be present. Which are all the two areas? Opioid poisoning and Pontine hemorrhage. Okay, but in Pontine hemorrhage, abnormal breathing, that is irregular breathing will be there, but in opioid poisoning, respiratory depression will be there. That's why we have selected option A. Horner syndrome is totally different, that is sympathetic nervous system is affected, meiosis, ptosis, anhidrosis will be present, but this type of pinpoint pupil will not be there. Okay, and the last one, third cranial nerve palsy, there is oculomotor nerve palsy. It will cause dilated pupil, not the pinpoint pupil. So we can eliminate option D also. So the last option, which is the right one? Option C, that is Pontine hemorrhage. I would like to give additional point related to the Horner syndrome. See, Horner syndrome, first important point is here the sympathetic nervous system is damaged. Once the sympathetic nervous system is damaged, you can see these symptoms from the patient. What are the symptoms? Anhidrosis, meiosis, ptosis, loss of ciliospinal reflex, and enophthalmos. Not exophthalmos. Exophthalmos means protrusion. Enophthalmos means sunken eye. Understand, right? So what is anhidrosis? See, the sympathetic nervous system which is supplying to the sweat gland is affected. So decrease in the sweat gland in the affected side. For example, right side sympathetic nerve is affected means right side sweat gland will be affected. There is no sweating in the right side. Okay, right? That is called as what? Anhidrosis. Meiosis. Meiosis means, see, the sympathetic nerve which is causing, you can see here, unopposed parasympathetic action causes contracted pupils. Meiosis means contracted pupils. See, sympathetic nervous system will cause dilatation of the pupil and parasympathetic nervous system will cause contraction of the pupil. Here the sympathetic nervous system is affected, so parasympathetic nervous system is actively involved. So continuous contraction of pupil will take place. That's why meiosis. What about ptosis? See, the eyelid, it is supplied or maintained by the Muller muscles, and Muller muscles are controlled by the sympathetic nervous system. If the sympathetic nervous system is damaged, Muller muscles will be damaged, so ptosis. Loss of ciliospinal reflex. Usually, what is ciliospinal reflex? If you are pinching the face, or if you are giving pressure over the neck or pinching the neck, shoulder, back, immediately dilatation of pupil will be taking place. This is the normal phenomena. But if the sympathetic nervous system is affected, this mechanism will be affected. So here that is called as what? Loss of ciliospinal reflex. And the last one is enophthalmos. Again, because of damage of the sympathetic nervous system, eyes will become sunken. That's why it is called as what? Enophthalmos. Okay, so these are all the things you're supposed to remember. For that, the better key point or mnemonic is sample. Sample. S stands for sympathetic nervous system damage, A for anhidrosis, M for meiosis, P for ptosis, L for loss of ciliospinal reflex, E for enophthalmos. Question number 6. A newborn has a high-pitched cat-like cry and developmental delay. Which syndrome is associated with these findings? Here the key point is cat-like cry, developmental delay. High-pitched cat-like cry. In which syndrome this high-pitched cat-like cry will be present? This is the question. 4 options they have given here: Down syndrome, Cry-do-chat syndrome, Edwards syndrome, Turner syndrome, and here the right answer is option B, that is cry-do-chat syndrome. Always remember, C stands for cat-like cry and C stands for cry-do-chat syndrome. In cat-like cry, in cry-do-chat syndrome, what will be present? Cat-like cry will be present. C for C, like that, remember. Cry-do-chat syndrome, what is present? Cat-like cry. What is this cry-do-chat syndrome? See, in cry-do-chat syndrome, the abnormal development of the larynx and the nervous system is taking place. So, whenever the baby is crying, that time because of abnormal development of the larynx, the baby will make a high-pitched cat-like cry will be there. Okay, so this is called as what? Cat-like cry, which is commonly seen in the cry-do-chat syndrome because of the delay in the development of larynx. What about other conditions? Everything is there, don't worry. See, in Down syndrome, you all know that it is also called as trisomy 21 because usually human chromosomes are 46. But here in Down syndrome, +1 chromosomes will be present. That's why here I have mentioned 47 chromosomes. Which chromosome extra copy is present? 21st chromosome extra copy is present. That's why it is called as what? Trisomy 21. Okay, 21st chromosome extra copy is present. That's why it is called as what? Trisomy 21. Here you can see intellectual disability, flat face, single palmar creases. These are all the classical symptoms of Down syndrome. The next one is Edwards syndrome, very important one. Let me show some images also. It is also called as trisomy 18. Edwards syndrome is also called as trisomy 18. So what is happening here? Here also, see, as I mentioned already, normal human chromosome is 46. But here one extra chromosome is present. So 47 chromosomes are there. How many chromosomes are there? 47. So here 18th chromosome, one extra copy is present. In Down syndrome, 21st chromosome, one extra copy is present. No, same way in Edwards syndrome, 18th chromosome, one extra copy is present. That's why it is called as what? Trisomy 18. Here what is present? Clenched fist, rock bottom feet will be present. See, I will show the additional points also. You can see here. Edwards syndrome. The first important point already asked in the exam is this one. See, usually in the normal humans, this type of arch will be present in the sole of the foot. This arch will be present. But in Edwards syndrome, that is trisomy 18, what is happening? Charcot foot will be present. Very important point. Okay, it is also called as rocker bottom deformity. Why? See, this arch will not be present here. See, this arch, you can see this is the normal arch which is present for the normal humans, but in trisomy 18, that is in Edwards syndrome, this arch will not be present. It will be like this. Okay, so you can see the C-shaped arch. Okay, right? Prominent C-shaped bone will be present. Okay, like this. Like this. Okay, so this condition is called as what? Charcot foot. It is also called as rocker bottom deformity, commonly seen in the Edwards syndrome. The first important point is over. Second important point, craniofacial features in Edwards syndrome. These things are very important. See, microcephaly will be there. Okay, the first point, microcephaly, cleft lip, cleft palate, prominent occiput. Here also prominent foot. That's why rocker bottom feet. Here prominent occiput will be there, low set ears. Micrognathia, that is small jaw. Jaw will be very small. And high arched palate. Hard palate, soft palate is there. No, it is highly arched. So these are all the classical signs of Edwards syndrome in craniofacial features. Apart from that, these foot features, please remember, apart from that, hand features are also there. That is overlapping fingers. Clenched overlapping fingers. So if these key points are present, means you have to think about what? Edwards syndrome. Okay, pause the video, understand the concept. Okay, the next one is Turner syndrome. See, Turner syndrome, we know that one chromosome is missing. Usually the normal chromosome is 46, right? But here only 45 chromosomes are there. One chromosome is missing. That's why it is called as what? Turner syndrome, commonly seen among the females. Short stature, webbed neck will be present. Webbed neck will be present. Okay, and last one is cry-do-chat syndrome. So this one causes developmental delay, especially laryngeal development is affected. That's why high-pitched cry will be there. The cry will be similar to cat cry. Okay, so that's why it is called as what? Cat-like cry. Here what is happening? Here 46 chromosomes are there, but the fifth chromosome is very short. See, this is the structure of the chromosome. Example I'm drawing, okay? But the fifth chromosome, this part is missing. So here the part is fully present, but here only half is present. Okay, so deletion of the short arm of the chromosome 5. Okay, so if these key points are present, means that is called as what? Cry-do-chat syndrome. Okay, guys. So for this question, the right answer is option B, that is cry-do-chat syndrome. So the next question is question number 7. 32-year-old patient is diagnosed with drug-sensitive pulmonary tuberculosis. So, drug-sensitive pulmonary tuberculosis. The physician decided to follow the latest WHO recommendation. This is the key point, latest. Okay, so there is some changes in the WHO TB drug regimen. That changes happened on 2025. Okay, so we will discuss about that. Which combination of drugs will be prescribed during the intensive phase? So this is the question, guys. So 4 options they have given here: isoniazid, rifampin, pyrazinamide, ethambutol. This is the normal drug which we can give for the patient in the intensive phase previously. But nowadays some changes was happened. What changes? See, here the right answer is going to be option B. See, isoniazid, rifampicin. See, previously rifampicin was there, but here the rifampicin is changed to rifampicin. And isoniazid is same, pyrazinamide is same, and ethambutol, it is also changed to moxifloxacin. Moxifloxacin. See, 2 things are changed. That is, rifampicin and moxifloxacin is added newly in the intensive phase therapy, drug TB therapy. Okay, right? You can see here. For your better understanding, I added this one. New TB guidelines, which is started on 2025. Old standard regimen and new standard regimen, I have classified these 2 things. Old standard regimen, the duration is 6 months, and new standard regimen, the duration is for 4 months. In old one, HRZT will be there. That is isoniazid, rifampicin, pyrazinamide, ethambutol was there. But now it is totally changed. That is HPZM. HPZM, that is isoniazid, rifampicin, pyrazinamide, moxifloxacin is there. Previously 6 months duration, now the duration is changed to 4 months. So these are all the guidelines which is transformed or changed from 2025. Okay, based upon this one, the right answer is going to be what? Option B, that is isoniazid, rifampicin, pyrazinamide, and moxifloxacin as an intensive therapy for the drug-sensitive pulmonary tuberculosis. Latest one. Okay, the next one, question number 28. A 28-year-old man present with the chronic low back pain, morning stiffness for the past 8 months. He reports that the pain improves after exercise. First key point, pain improves after exercise, but worsen after the rest. Improves after the activity, worsen in the rest. X-ray shows bamboo spine. Third key point. And appearance, okay, bamboo spine appearance in the X-ray. Which of the following is the most likely diagnosis? So 3 key points they have mentioned here. That is, the pain improves with the activity and increase with the rest, and the X-ray shows bamboo sign. See, bamboo sign in the X-ray clearly take you to the answer. 4 options they have given here: osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, or gout. And bamboo sign is present means it shows the patient is suffering from ankylosing spondylitis. Spine is affected, vertebral bone is affected. So option C is the right one. Why? Clearly I have mentioned in the rational. Listen, golden points are there. Osteoarthritis. See, osteoarthritis, joint pain will be there, but the pain worsen with the activity. But here they mentioned that the pain worsen with the rest. In the question they have mentioned the pain worsen with the rest. But here the pain worsen with the activity. So pain worsen with the activity is commonly seen in the osteoarthritis. Next one is rheumatoid arthritis. Rheumatoid arthritis, small joints are going to get affected first in the rheumatoid arthritis, especially in the hand and the wrist. Okay, so we can eliminate this option also. Ankylosing spondylitis, very important one. Bamboo spine is seen in the ankylosing spondylitis, and inflammatory back pain will be there because spine is affected. Morning stiffness is present. Improvement with activity is there. If you are doing the activity, the pain will be subside. Okay, so these things are matching with the question. That's why we selected option C, that is ankylosing spondylitis, as a correct one. And the last one is gout, because of uric acid accumulation, especially in the small digits. Severe pain will be there. That is called as what? Gout. Especially the uric acid accumulation. It is seen in the grade 2. That is called as what? Podagra. Okay, so these are all the key points, guys. Okay, so next one, question number 9. The color coding in IMNCI, that is the full form is Integrated Management of Neonatal and Childhood Illness. Usually for the kids less than 5 years, they are coming under IMNCI, that is Integrated Management of Neonatal and Childhood Illness. Okay, so they are giving some color codes to treat the children's. Okay, so less than 5 years coming under IMNCI, and they are giving the color codes, and here they have given some key points. See, which includes initiation of specific treatment at an outpatient health facility is. Initiation of specific treatment at an outpatient health facility is. So this is the key point. So this key point is matching with which code? 4 code they have given here: pink code, yellow, blue, green. So a kid can be treated with the specific treatment in the health institute, any health institute, that might be a PHC or sub-center or a hospital in the OPD basis. Any sub-centers we can take the child for specific treatment. Here the child is not very sick, any urgency is not there, these key points are not mentioned, just they mention specific treatment in some health care institutes, that's all. So this key point is present means that is coming under what? Which category or which color code? That is coming in yellow color code. I will show the image. So the right answer is what? Yellow. Why I selected yellow? You can see here, pink code refers to the child is very, very sick. Does that sick is mentioned here? The child is very sick is mentioned in the question? No. And if in that case, the child is very sick means urgent referral to the hospital, so that the patient will get admitted and they will take the treatment. But here, outpatient they have mentioned. So we can eliminate option A, that is pink. Yellow, child is moderately sick. So outpatient treatment in any health center is okay. So that's why this one is the correct answer. Green means very less illness. Home care is enough. Home care treatment is enough. That is green. Blue is not involved in the IMNCI. Okay, guys. So that's why I selected option B, yellow, as a correct one. And last question, question number 10. A chronic alcoholic present with confusion, unsteady gait, nystagmus, which syndrome is most likely? Alcoholic present with the confusion, first key point, unsteady gait and nystagmus. Nystagmus. Which syndrome is most likely? Beck syndrome, Virchow syndrome, Wernicke encephalopathy, Cushing disease. So Cushing syndrome. 4 options they are given here. So here the patient is affected mentally because confusion is present, nystagmus is present, unsteady gait is present. So this kind of symptoms is present means it is commonly seen in the Wernicke's encephalopathy. Option C is the right one. Encephalopathy, disorder in the brain. Wernicke's encephalopathy. So let's discuss each and every option with the key points. See, in cardiac tamponade, you can expect Beck's triad. What is Beck's triad? Hypotension, jugular venous distension, muffled heart sound will be present. Very important point, many times asked in the exam, Beck's triad. And in case of DVT, you can expect endothelial injury of the blood vessel, hypercoagulability state, and stasis of the blood flow in the foot. So these 3 things are present means that is called as what? Virchow's triad. Virchow's triad you can see in the DVT, deep vein thrombosis. And Wernicke's encephalopathy, what is happening? Wernicke's triad will be present. That is confusion, ataxia, oculomotor dysfunction. That is nystagmus. These 3 things are present means that is called as what? Wernicke's triad. And the last one is Cushing triad. Here they mentioned Cushing syndrome. Actually, it is wrong. Okay. So Cushing triad, the Cushing triad, hypertension, bradycardia, irregular respiration will be present. Okay. When these things will be present? In case of increased intracranial pressure. Okay. So these are all the different types of triads, guys. And the one which is causing confusion, unsteady gait, and oculomotor dysfunction, that is nystagmus, commonly seen in the Wernicke's encephalopathy. So here the right answer is option C, Wernicke's encephalopathy. So many important questions, rationals of each and every options, additional golden points, image-based content, everything we have covered in these 10 questions. So Please understand the concepts. Always you should ask why. Then only you will get to know the rationale behind each and every options. Okay, like this only you have to study. Okay, so all the best for your upcoming examinations. So Metier is keep on providing so many courses for your upcoming competitive exams. So to know about all these details, please call to the number which is mentioned down. Okay, right? So all the best for your upcoming examination, and share the video as much as possible to most of the students so that they can get the benefit also. Okay.